in my final year of college, I wasn't quite sure what I was going to do. At that time, I was considering both law and medicine, believe it or not. And in my final year at Harvard, I actually applied to Harvard Law School, was accepted, but just as I got accepted, I heard some terrible news. My sister was diagnosed with acute leukemia. And that turned my life upside down, of course. And I had to think about the choices that I had ahead. So I called the dean of Harvard Law School and I said, you know, this is an unusual situation. I was looking at both careers and I asked her, what would you do? And her answer was, lawyers never cured anybody. So I just remember those words to this day. And I made that choice and I went forward with medicine. My sister is alive. She went through quite a bit, as most cancer patients have to. She went through chemotherapy, a transplant, therapy after the transplant, and she's really a miracle. She survived. This is such an exciting time. When I first started in oncology, we really had very few tools at hand, very few ways to help people. But quickly we started to understand how cancer cells grew and their inner mechanisms, their what we call their communication pathways or signal transduction pathways. And we started to unveil the mysteries of the cancer cell. And through an expansion of the knowledge of the biology of how cancer cells grow, we've now developed a whole spectrum of new medications to help patients. Those days at Sloan Kettering were wonderful days in the laboratory. I worked with some of the most brilliant minds. John Mendelsohn, who later became the president of MD Anderson Cancer Center, was my boss. And I had access to the most brilliant thoughts, basically, in medicine at that time. And the laboratory that he guided actually developed two of the foremost medications that are now used in cancer treatment, Herceptin and Erbitux. My project was understanding how these very truly wonderful medicines stop the cancer cells from growing. There was a revolution in understanding the cancer cell dynamics, and we were at the cutting edge there trying to get to the heart of the matter. What we call today targeted therapies are understanding the points or the weaknesses in the cancer cells that we can interrupt very precisely. Precision-directed medications that are personalized now for patients. So now we're understanding the whole vast landscape of cancer growth and the mechanisms, and we're able to decipher and analyze these mutations or these defects in cancer cells that people have, and then pick the right medicine for that person.
It took months for them to diagnose me, and then he wanted to go further and make sure that he was going to give me the right chemotherapy. He sent me to surgeons. He sent me everywhere to make sure that this was what the only answer was going to be. And I had an unknown primary, so they had to do DNA testing and send it to California because it showed up on the outside of my lung and it came as a stage 4. But it turns out it wasn't lung cancer, it was ovarian cancer. So that's how we found out, by sending that out. And I mean, he's just brilliant. He's just totally brilliant. And he's just, I couldn't say enough about him. I really couldn't. God just put these people here, and it's a special, special gift they have. I just feel so blessed right now. I think I drive people crazy because, you know, I'll get out of the car and I'll go bopping into Publix and all the way up there I'm going, hi, how you doing today? You know, and people must think I'm crazy. But I just didn't figure I'd be here. That's all. I really didn't. And every time I come in for my checkup, Dr. Rubin will walk in and he'll go, here she is, Miss Boring, because, you know, it's gone for now, and I'm in remission. And this time when I came in, he said, everything looks great. It's looking great. I said, oh, I'm not boring anymore. Nope, you went from boring to great. And I said, okay.
I know that every day I come here, it's not just a cold scientific laboratory. I used to work in one. And it was wonderful. It was a wonderful experience understanding how the cancer cells were growing. But I come to work knowing that I'm applying that knowledge from the laboratory to the patients that so dearly need it, and their families. The reason why we do this is for people.